views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗏𝗏𝗵𝗹 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗵𝗹. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗵𝗹 on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗵𝗹, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗵𝗹 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗵𝗹. I'm your host, Nicole Jacinto. Today, we're going to talk about pharyngitis. Now, what exactly is pharyngitis? Well, we'll find out in just a minute when I introduce our guest to you and we start talking about the subject. Okay, our guest is Dr. Charles Mendez, and he's from the prestigious Makati Medical Center in the Philippines. Good afternoon, Dr. Mendez. How are you today?
Good afternoon, Ma'am Nicole Jacinto. Good afternoon also to our listeners and televiewers. From DZRJ Radio Bandido po.
Yes, thank you. Thank you to all the listeners and viewers who are listening, watching, and viewing on all sorts of platforms, on all the different platforms. Just call me Nicole, Dr. Charles. And so, Dr. Charles, before we get into the topic of what pharyngitis is and you explain all of these things to us, can you tell us what your specialty is?
Okay, my specialty is ENT head and neck surgery. So anything that has to deal with the ears, nose, throat, head and neck, excluding the eyes and excluding the brain po. That's our main niche.
Okay, great. Okay, so before we talk about pharyngitis, Dr. Charles, whenever there's an itis at the end, we know this is the inflammation of something, so can you tell us what organ this is? Okay, so for those of you who are into the Exodus book in the Bible like me, it's not the inflammation of Pharaoh. It's the inflammation of the pharynx, which Charles will tell us more about. So can you tell us, Dr. Charles, what about the organ? If it's an organ, is it an organ, the pharynx, and where exactly it's located in the body?
Okay, so our oropharynx is actually a part, a part of our lalamunan. So basically, in layman's term, that's the lalamunan. Okay, so it's located deep behind our throat area.
Okay, so it's located.
And when we say, sige po.
Go ahead, Dr. Charles.
So when we say it's pharyngitis, it's basically an inflammation of the linings of the lalamunan or the pharynx.
Okay, so that's great. So it's the inflammation of the linings of the throat or lalamunan, and it's located in the back part of the neck area. That's after the, okay, is the pharynx part of the digestive system or the respiratory system?
Actually, both. Our pharynx being located just the back of your tongue, okay, and the back of your tonsils. It's both a conduit for breathing as well as swallowing.
Okay, so that's great. So, because a lot of people may have heard of, the larynx or the voice box, but they may not be as familiar with the pharynx and what its functions are. So if I'm correct, I'm trying to picture it for other people and put it in words. If you open your mouth or you try, your piece of food or whatever traveling down somebody's mouth, there's a tongue, and then we have our epiglottis and our tonsils, and then behind that is the pharynx. Okay, all right. So, Doctor.
Correct.
What exactly is the function of the pharynx in the body, or is it just an area that you name just so that, just to inform our viewers more?
Okay. So to be particular, as you mentioned, ma'am, it's the oropharynx. So
Please
our
don't call
pharynx
me
is
ma'am.
subdivided.
Don't call me ma'am, doctor. There's
Uh,
no need. Absolutely. Just call me Nicole. Go ahead, doctor.
okay, Nicole. Okay, our pharynx is subdivided into three parts. So we do have our nasopharynx, which is the pharynx behind your nose. We have our oropharynx, which is behind your throat, and we have our hypopharynx, which is deep behind,
Mhm.
below our oropharynx. Our larynx or our voice box is deeper than the hypopharynx. So
Oh,
basically, as you mentioned nga, it's both part of our respiratory and digestive system talaga. Kasi it transects and it traverses both our breathing and swallowing function.
thank you, Dr. Mendez, Dr. Charles. Okay. So, Dr. Charles, what happens when someone contracts? There's no such word as contracts. Okay. When someone contracts pharyngitis, what happens then? I mean, does
Okay. Uh, what happens there is there will be inflammation of your throat. Hence, you will have a myriad of symptoms that might be manifested by the patient.
okay. Can you ask you about the symptoms, Dr. Charles? Like, what are the more common symptoms or the symptoms of pharyngitis in general?
Okay. In general, basically, it depends on the cause, but well, in a nutshell, usually it's throat pain, difficulty of swallowing, sometimes voice changes, or sometimes there is a sticking material deep inside your throat that every time you swallow, parang there's something in there, which what we call or term as global sensation. Other constitutional symptoms can be also manifested by the patient, such as fever, body pains, and etc.
Okay. Um, is there what causes pharyngitis?
Okay. Actually, this is of paramount of importance na question because clinically, when we see a patient in the clinic, we are quite um, inquisitive with regards to the symptoms of the patient kasi that may point out to the possible cause.
Mhm.
So the most common cause is actually an infection, which might be a viral or bacterial infection. On 30 to 50, perhaps 50 to 80% of cases, it's a viral pharyngitis or a viral cause.
Mhm.
Other cause can be also allergies, can be also reflux, can be also chemical irritants such as your smoking, can
Mhm.
also be actually hyperacidity, and on some extreme cases, it can be cancer.
Okay. So that's great. I mean, not that it's great for people who have it, but I mean, you answered the question very thoroughly. And as you said, when you examine a patient and you ask them questions, that's why you're very inquisitive about it because it could
Yes,
be due to a viral or bacterial infection that just, occurred in someone. It could be due to acid reflux. You mentioned that. Yeah, and that's not many people
yes,
know that, it does, the reflux does go all the way to the throat and can cause problems for you or even make you feel like you have a sore throat or asthma or
correct.
something. But at that point, I guess your pharynx has already been affected or, by the acid. And then maybe if you always have allergies, I mean, that part is affected, your pharynx. And then also you did mention chemical irritants like cigarettes or like when you smoke or maybe any other thing. Um that's why and then you said, of course, the last thing, like it could be cancer, of course. And if
Yes.
you can rule that out anyway with all your examinations. Now, when you have is there a type of, have you found that in your practice there's a type of person or a kind of profile of a person who's more susceptible to getting pharyngitis compared to others?
Yes, actually. So in practice, the
Mm-hmm.
subpopulation population of 5 years old or below are more prone to have pharyngitis, as well as patients who are elderly and do have low immune system or poor immune resistance, plus the fact that if a person also has habitual smoking or vaping, they are quite prone to manifesting and developing pharyngitis.
Okay. Does it have anything to do with also like just curious here, like changes of weather, or do you find that people who maybe uh live in weather that's colder or hotter, like it could be like, they're drinking water with too much ice, because that happens to us here in the Philippines, like sometimes will manifest, or people who swim and then get out of the water, that kind of thing. Does that happen as well? Like, do the patients,
Yes.
they say like, I went
Yeah.
swimming, it's so hot, and then
Actually,
yeah.
well, first things first, our climate in the Philippines is quite tropical, right? So
Yes.
basically, also, if someone suffers from allergic rhinitis, so it's actually like a nasal symptoms, secondary to possible triggers such as dust, animal danders, and so on and so forth. They are quite prone to developing uh, allergic, perhaps pharyngitis. Also, with regards to your question, if someone was exposed to a cold temperature, for example, swimming, if a person kasi actually entered or habituated a very cold temperature, the immune response of the patient can lower. So the viral infection thrives more on lower temperature, hence they can develop pharyngitis as well.
Thank you, doctor. Yeah, because I mean, we'll notice sometimes that it's very hot outside, and then you'll jump into a cold body of water, and then kind of be dipping in and out throughout the day, or it's very hot, but then you ride in so you're wearing like a t-shirt or something, and then you ride in a vehicle, and you're stuck in traffic for hours, and then it's very cold because the air conditioner there, or enter a building. So that's
Right.
go around with a jacket like an idiot, because I just don't every temperature, like it's kind of hard to adjust. But so, like, if there were weather changes, or someone traveled or something, and from a hot place to a cold place and came back, that could also affect it. So it's like, and
Yes.
okay, is it always the cause of pharyngitis? So you mentioned a lot of the possible causes, and then the fact that that you also mentioned like what kind of pharyngitis. It could be viral or bacterial. Can you explain the difference
Bacterial. Yeah.
audience between viral and bacterial meningitis? Meningitis, sorry, pharyngitis.
Pharyngitis.
Sorry, yeah. I don't know. It must be the heat exhaustion today. It's very hot out. Yeah.
All right. So anyway, so viral pharyngitis. So well, perhaps more often than not, it manifests first with an upper respiratory tract infection. For example, cough, colds, body malaise or body pains, with or without fever. More often than not, they develop and they can be contracted with a viral cause of pharyngitis. In comparison with a bacterial pharyngitis, more often than not also, they manifest with sore throat, also with difficulty of swallowing. Their fever is quite persistent. And when we inspect their oropharynx, okay, they manifest more often than not with exudates or pus on their tonsils as well.
This is if it's bacterial. More
Yes,
often. Okay. Pus on
and
your
they
tonsils.
do also yes, if it's bacterial, they also do yes, they also manifest with sometimes neck pain secondary to inflamed neck nodes or
Ah,
colani in the vernacular term. Yeah.
okay, yeah. So if it's bacterial, it's often I mean, they often manifest that way, and there can be pus on the throat area or tonsils. And then can you get tonsillitis and pharyngitis at the same time?
Yes, actually, they simultaneously present. Yes, they can be manifested by a patient simultaneously, and what we term that is an acute tonsillopharyngitis.
Okay. Can a person get tonsillitis, pharyngitis, and laryngitis at the same time?
Actually, yes, more often than not, if it's a viral infection, some patients who come in the clinic can manifest not only with nasal congestion, sore throat, they can also manifest with hoarseness of voice as well.
Okay.
So checklist, check.
Check. Okay. So it's I guess it's really important to come in. I mean, obviously someone will be in pain, a lot of pain when they have all of these symptoms, whether it's tonsillitis alone can cause a lot of pain. Pharyngitis alone can cause a lot of pain. I mean, obviously if you have laryngitis, it can cause a lot of pain as well. So
Right.
it would be really important. I urge the listeners and viewers to go to an ENT to have
Yes.
yourself checked out if this is persistent, because so the doctor knows exactly what to treat and how to diagnose.
Exactly.
Speaking of diagnosis, doctor, we let's go into that, but we just have to take a really short break before we discuss how you diagnose pharyngitis and all these other things, how you treat it, what happens if it just goes on, and a doctor like yourself doesn't check it out. So everybody, just hang in there. We'll be just go to the bathroom or something, but stay tuned to Healthline with Makati Med. I'm your host Nicole Jacinto. We're here with Dr. Charles Mendez, and he is an ENT, and we're talking about pharyngitis, which really actually may hit you at this time of the year. Okay, so stay tuned to Healthline with Makati Med. We'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. 𝗛𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City. This is Dr. 𝗛𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗛𝗶𝘶𝗵. Available for outpatient care services, our 𝗛𝗶𝘶𝗵 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗠𝗸𝗁𝗵𝗹 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the 3rd floor of 𝗠𝗸𝗁𝗵𝗹 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗠𝗠𝗁𝗵𝗵𝗹. Hi, this is Dr. Jacinto from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable via Makati Med Mobile Care Access. As the name suggests, this service is mobile, which means that we go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on your needs. We can go to any location of your choice within the metro and readily offer these healthcare services to communities or groups. For added convenience, different modes of payment are available, including HMO benefits for those with a valid letter of authorization. We believe that access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For inquiries, scheduling, or pre-registration, you may reach out to us at the following numbers. We look forward to coming to you and serving your community with Makati Med Mobile Care Access.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Hello, Miss Nicole. Sorry, I cannot hear Miss Nicole.
Okay, welcome back to Healthline with Makati Med. And I apologize, folks, and Dr. Charles. I guess I'm a bit nervous because I muted myself accidentally, and then I started fussing with my video button. So anyway, that's what happens during a live show. I apologize for that to everyone who's listening and watching, and to you, Dr. Charles. Okay, you can hear me now? Yes? All right. Okay, so Dr. Charles, we're talking about
Loud and clear.
pharyngitis today. Thank you. Talking about pharyngitis today. And of course, you're an ENT, otolaryngologist ENT, and you're the person to talk to about this. Just to recap for those who are maybe not, for who are already tuned in or just tuned in now, it's an inflammation of the lining in your throat, as you said, and the pharynx is an organ which is located, well, there's three parts you mentioned, like behind your nose, and then below that, before the larynx, which is the voice box, and it is part of the digestive and respiratory systems, both systems. So when you treat, Dr. Charles, for pharyngitis, it's important to go to an ENT when you've had symptoms like the ones you mentioned, sore throat, maybe tonsillitis already, you know that, you have a cold and a cough, and you said it could be viral or bacterial. And you also told us that, like, usually when it's viral, it presents in a certain manner. When it's bacterial, there could be pus even on the area, no, in your throat area. And how do you diagnose pharyngitis when a patient comes to you? And like how do you know whether it's a viral or bacterial pharyngitis?
I see. So thank you for that question, Ms. Nicole. Regarding the diagnosis of pharyngitis, it's mainly clinical. So basically, when a patient presents to our clinic, again, as I've mentioned, we're quite inquisitive because we know, we need to know the exact and we need to identify the exact cause of the pharyngitis. Because that treatment should be tailor-fit for the patient. So basically, once we already identify the risk factors, the possible predisposing factors, and the possible triggers, the patient, that's the time that we will evaluate. Aside from that, we need to check if there are any neck nodes from the patient, because that will point the possible cause, also the underlying cause from the patient. So once we elucidated that, okay, that's the time that we'll give proper and adequate treatments for the patient.
Okay, so I'll just recap that, Dr. Charles, because for me the sound got kind of cut in and out a bit when you were talking. And then please jump in and correct me if I'm wrong at any point. It's really important for the patient to go to you in person and do the clinical diagnosis. And it's really important you are inquisitive at that time, because it's really important for you as an ENT to know everything that may have caused it, or whatever may have caused it, what the possibilities are, and check on the patient. Like, you have to know every detail so you can start, I guess maybe I'm paraphrasing here, like eliminating causes. Understanding that this may have happened, that may have happened, and you have to see the actual lining of the throat, and then you would also understand some of the risk factors or predispositions that the patient may have, and why they developed pharyngitis in the first place. Was that okay? Okay.
Yeah.
Okay. So
aside from that,
yes, go ahead.
Sorry. Aside from that, sometimes when we see pus, there is what we call as a throat swab that we do in the clinics. Okay, the throat swabs kasi can be sent to the laboratory to check whether or not which particular bacteria might have caused that, because we have what we call as culture and sensitivity in the laboratories. So for the culture, we culture the bacteria, and for the sensitivity, we want to check which kind of antibiotics might be prescribed to the patient, or perhaps sometimes if the patient is resistant to the antibiotics, we might give another antibiotics that are quite which bacteria are susceptible to and from that antibiotics.
Yes, that's a great point, Dr. Mendez, because okay, like, for example, what's the difference between strep throat and the streptococcus bacteria, whatever type it is? I don't know, Aureus, I don't know, I can't remember my basic science with those things, but sometimes people say, oh, you have strep throat, or a doctor will say you have strep throat and you also have pharyngitis or something like that. So so you can go ahead and answer the question, like, would if you know the type of bacteria, then you can target it.
If we have proven that the actual cause of the throat infection is a strep throat, okay, usually in the developing countries it happens kasi. And aside from that, we are quite more aggressive if it's a strep throat. At the same time, the duration of the treatment should span from 7 to 10 days because we want total eradication of the bacteria. The thing is, with regards to strep throat sometimes can develop rheumatic heart disease, or perhaps sometimes post-strep glomerulonephritis or kidney problem. That's why we want total eradication of the strep throat infection, if it's really a strep
If it's really strep throat. Yeah, kasi some people will say, ang arte naman yan. Why do I have to take it for 10 days, antibiotics, and this type, when this one is cheaper, or I feel better already in 5 days. And that's the reason, because you really want to kill that
Correct.
strep throat. And it can travel
Yes.
to, I don't know, some tonsillitis or sore throats or something can even cause, like, let's say, rheumatic heart fever, or as you said,
Correct.
an infection in the kidney, no? Some
Exactly.
Okay, so it's that important that you follow
Yes.
Dr. Mendez's orders when he gives it to you. It's that important. That's why he's like, what do you use to swab? Just to describe to a patient who maybe is not used to getting their throat swabbed by a
Okay.
you,
Okay. It's like the swab is like a sterile cotton pledget. Okay. And then, well, if you were like swabbed before with a from a COVID infection, it's somehow similar to that. Or
similar
a
to,
cotton buds perhaps, or Q-tips. Yeah.
yeah, like a long Q-tip or something,
Similar
and
to that.
similar to that. Okay.
Exactly.
All right. Thank you, doctor, for describing that, and emphasizing the importance
Sure.
of why you need to get diagnosed in person, or why you might send something to, I mean, a culture, or a sample, sorry, to the lab for culturing, and so you know exactly what it is, and also what type of antibiotic to give. Now, what happens if a patient says, I mean, if a patient
Yes.
is happens to be allergic to that antibiotic that you want to give? What's your protocol? What's the next best thing?
A very good question, Miss Nicole. So basically, we do have first line treatments,
Mm-hmm.
okay, that can cover the bacteria.
Mm-hmm.
So perhaps like strep throat, that can cover strep throat. However, if the patient develops allergic reaction or adverse reaction secondary to that antibiotics, there are alternative regimens,
Mm-hmm.
or basically a second tier treatments that we can prescribe to the patient. It's based on our national guidelines for pharyngitis or tonsilopharyngitis.
Thank you, Dr. Mendez. And okay, what treatment options are available exactly for pharyngitis, like aside from antibiotics? And I mean, what other things do you tend to prescribe, or maybe have seen in your patients that you've needed to have them do?
Exactly. Okay. So if a patient at home
Mm-hmm.
does not like um, progress or improve after home remedies, they will come to the ENT, diba? So after antibiotics, aside from the main antibiotics, we tend to give pain relievers to decrease the inflammation and decrease the pain of the patient.
Mm-hmm.
Sometimes we do also give the patient gargles, antiseptic gargles or warm saline gargles. On
Mm-hmm.
other times, if the pain is quite persistent or the swallowing is quite impeded in the patient, we also tend to give some topical anti-inflammatory sprays.
Okay, that's great to know that yeah, it is painful. Having sore throats can be really, really, really painful and debilitating. When we don't have it, it's something we take, a lot of
Yes,
people, sore throat lang yan, ganon lang. Pero the person is really
correct.
like incapacitated. Kasi ang sakit nun, then you can't even talk, express yourself. Parang anything you do, you
Yes,
can't get away from the pain. Um, as and then you mentioned some home remedies. What could those be? Like, do you still advise patients to, when we were growing up, it was like gargle with salt and warm water. What, like, can
correct.
you give us some of the things that, like, okay,
Sure.
you've given them antibiotics, they go home, and then what else? What other instructions do you give them?
Okay. Home remedy. Okay, home remedies. Aside from that, if like antiseptic gargle is not
Mhm.
available, we give salt warm salt water gargle. So it's basically just a cup of warm water
Mhm.
mixed with 1/4 to 1/2 teaspoon of rock salt.
Mhm.
Sometimes we also do add baking soda also. Some patients do tend to uh, also ingest and gargle honey lemon, okay, because it possesses antimicrobial properties and it suits the pain in the throat as well.
Mhm.
Some other times, we always advise our patients to prevent exposing themselves from, of course, chemical irritants, again, such as smoking, and to avoid and refrain themselves from drinking or eating very, very hot and very, very cold food and beverages because it can also irritate the lining in the throat.
Okay. So there we have like kind of a myth buster because, I mean, you'll hear a lot of people say, "Oh, you have a sore throat. Drink this very, very hot." They automatically assume they will tell you, "Oh, don't eat ice
Exactly.
cream." But yeah, but then they'll say, "Drink this very, very hot or very, very hot soup." But that can also be an irritant to the throat.
Yes, exactly.
I was right.
Correct.
No, just based on experience. Okay. And then, um, so it's warm water, not scalding hot water, and salt and honey lemon. I mean, I've heard of garlic as well, things like that. But along, of course, with what you prescribe, like the antiseptics that you can spray, and some painkillers. What kind of painkillers do you prescribe exactly? Are they just all topical, or do you also have painkillers that are, that need to go that are ingested in a pill?
Yeah, it may be either in the form of tablet or
Okay.
capsule. Okay, more often than not, we give acetaminophen or paracetamol. But if the pain is quite debilitating, what we tend to give is a non-steroidal anti-inflammatory drug, which is NSAIDs,
Yes.
such as your ibuprofen, mefenamic acid, and the likes.
Okay. And then, doctor, do because like thinking of people at home with sore throats, and again with the preconception, especially here in the Philippines, that we have like, some will say, don't use air conditioner and don't use electric fan, but the person is like, parang does that really affect it? Of course, like parang don't at all. And then the person is like sweating and all of that. Is that kind of temperature, like what's the ideal temperature for someone who is feeling in pain and who is suffering from pharyngitis?
Actually, to some extent, yes. To some extent, yes. So meaning, if you do have developed like pharyngitis, avoid very cold climate or temperature. Opt for the room temperature,
Room temperature.
perhaps like 25, 26 degrees centigrade.
Okay.
Yeah, if you do have some humidifiers at home, it might help also. Thing is, with regards to like the cold temperature, if you're quite exposed to that and you're habituated to that, it dries up your throat also, which might cause throat pain as well.
Okay. So then, of course, you would say drink more fluids. Like, I
Yes,
mean, that
yes.
helps. And then,
Yes. Supportive therapy measure we do advise our patients is to boost up, yeah, is to boost the immune system. So drink adequate amounts of water, like 8 glasses of water in a day, have some adequate rest, 7 to 8 hours of sleep, like that, because well, the body needs to replenish also and to boost up the immune system as well. Okay, to ward off the infection.
yes. And okay, so yeah, when your physician or your ENT, like Dr. Mendez, says drink a lot of fluids, that usually means water. And are there any, sometimes we have a conception that as long as it's fruit juice, it's okay. But are there any, do you have anything to say about that? And of course, you wouldn't be asking people to drink scotch, beer, and all these other things. And what about the fruit juices and the soda? Are there any,
Okay,
okay.
so another myth buster. So we do want the patients to refrain also from drinking or eating any kind of like extremely sweet or perhaps sweet in that sweet beverages because anyway the sweets or the sugar that can get from the food and the drinks might also irritate the lining of the throat. So it might also augment, or I sorry, it might also like it's like a double whammy. Okay, so it will not improve the sore throat.
Yeah. So okay. So like if you're drinking something that's too sweet also, like even if it's fruit juice that kind of, there's sugar, it makes you feel better. And maybe it's helping you build up, right? There's fructose in that, even if, well, they say it's freshly squeezed, unless you actually freshly squeeze it, then you're not quite sure. But you still drink the water and like, brush your teeth or something just to kind of get that extra that you don't need out of there. How about sodas? Because people say, I don't drink sodas or carbonated drinks. What's your take on that?
Okay, we do not really advise also patients to ingest or drink any carbonated drinks because number one, it can cause reflux as well, and we know that reflux, can be a trigger. It can also be a harbinger of pharyngitis. So at the get-go, we want to refrain our patients from drinking any type of sodas as well.
Okay, thank you, doctor. And then there's also the what temperature of the drink would you recommend? Well, you said not so hot. You did say that. You said not really hot, not really cold. Is it a Goldilocks thing where it's just right and what's comfortable for you, or would you say like no ice, that kind of thing, or room temperature, or what? Is there a particular like thing that we can sort of zone in on there?
Yeah. It's also room temperature, like 25 to 26 degrees centigrade, or perhaps a lukewarm water.
Okay, so that would be good enough for a lot of us to figure that out. I'm just gonna put one bit of ice in it. Okay, we've been through those negotiations in real life.
Exactly.
It's like okay.
Bargaining,
yes, bargaining with yourself. No, I just want a little ice, and I shouldn't have done that. Okay, doctor, what happens if you leave pharyngitis untreated? I know you mentioned some other, possibilities earlier for, let's say, a strep, but in general, what happens? What happens and what can happen if people are like, I'll just leave it as it is. I'll keep smoking and drinking and just dying of the pain or whatever. So what can happen if you leave it untreated?
Okay. I'll center my discussion on perhaps like a viral to bacterial pharyngitis. So a viral pharyngitis can manifest like 5 to 7 days. It should not be progressive. Okay. It's also can be addressed by supportive measures and symptomatic treatment. However, a viral pharyngitis can develop and can be super infected with the bacterial pharyngitis past like 5-7 days, up to 10 days. If the bacterial pharyngitis is not treated, the patient may manifest with worsening symptoms or perhaps complications. If a patient manifests with persistent fever, perhaps neck pain or pain in the neck, aside from that, the patient will have difficulty of opening the mouth, or what we term as trismus. Sometimes clinically, we examine the patient, and the patient also manifests with what we call as hot potato voice or changing of voice. Okay, those are cardinal symptoms and signs of a possible complications. That's why we need to stress to patients that number one, prevention is key. Number two, at the time of if you're manifesting with sore throat symptoms without any improvement, prompt evaluation and consultation by your ENT is paramount of importance.
Okay. So, and then go back to the doctor and say these things are, it's you didn't treat it, or you went to the doctor, then you just disregarded. So there. Okay. And be honest also in the interview, right, doc? Like if you're like,
Exactly.
Like, there
Yeah.
might be a teenager who has it, and then you're like,
There's no shame. There's no shame.
yeah, there's no shame. Like, there might be a teenager who has it, and they don't want their parents to know that they tried smoking or something or whatever it is. Give your doctor a signal, like, to tell you something, but they're going to kill me. That kind of thing. So that you can have the doctor-patient confidentiality you need just for that. Now, you
Yeah,
mentioned
or give some gestures.
make some gestures like, that kind of thing.
Yeah.
I'm not teaching you to lie to your parents. I'm saying you
Right.
have to be honest with your doctor. Really, you really have to be honest with your doctor because they can't help you if you don't give them all the information that they need. Okay. What are you did say prevent? You mentioned prevention of pharyngitis. Can you tell us about, like, how do you prevent getting pharyngitis in general, and if you are someone who frequently gets it, which might be alarming already in and of its. Okay, prevention first.
Okay, so I do have some like list of preventions. I always educate my patients for the pharyngitis not to recur again. So
Mhm.
first things first is to do proper hygiene. Like for example, do thorough hand washing regularly and refrain yourselves from any exposure from a close contact. Perhaps it's a coworker or someone that you live also at home. Um,
Mm.
Aside from that, uh, wear mask, okay?
Mhm.
Because if you're wearing mask in public places,
Yeah.
close communication and close contacts can be also triggers for the development of pharyngitis. So you prevent that.
Yeah.
So have some adequate rest. Also prevent yourself from being experiencing over fatigue.
Mhm.
Do drink adequately in a day. And again, as I mentioned, I cannot overemphasize
Mhm.
refraining yourself from any chemical irritants such as smoking or first and second hand smoke.
Mhm.
And of course, refrain also from having lifestyle that are predisposed to hyperacidity.
Yes, okay. What are some of the can you sort of tell us what are those lifestyle changes that one can make you that might give you hyperacidity, like aside from the stuff that you do to prevent catching a virus or and then it turning into a bacterial thing. What are some of the lifestyle changes that people can make to prevent getting hyperacidity that can lead to pharyngitis or pharyngitis?
Hyperacidity.
Okay.
Exactly. So, well, avoid stress, anxiety, because it can also give you hyperacidity. Aside from that, do drink lots of water, like again, 8 glasses of water in a day. Number three, avoid also skipping meals. So you need to have like frequent small feedings in a day. And number four, avoid also lying down or retiring to bed 3 hours prior to bedtime.
Okay. All right. Thank you, doctor. Do you have any like anything you'd like to say to people who have or may have pharyngitis or and any like final words of wisdom or any advice for preventing even the spread of pharyngitis? Anything you'd like to say about the topic at all?
Okay. So again, as I mentioned earlier, prevention is better than cure. So what the things that I have mentioned earlier, try to adhere to that. Aside
Mhm.
from that, if you develop symptoms of pharyngitis, well, you can do home remedies. However, if you tend to manifest with certain complications or complicated signs and symptoms, consult with your nearest ENT because, well, we we do not want any complicated pharyngitis in the clinic. So do seek your ENT, head and neck surgeon promptly.
Okay. Thank you, doctor. Is there anyone you'd like to say hi to before we sign off for this episode only? We'll be back, of course, next week.
Okay, so well, happy anniversary to my significant other. Today actually is our anniversary. Dr. Shannon Corsino is a cardiologist and fellow in St. Luke's Medical Center. I'm saying hi also to my parents, Dr. Charlie and Dr. Ellery, to my family and friends, and as well as my grandmother, Priscilla Mendez, and my my significant other's mother, Tita Aida Corsi. Thank you very much, Miss Nicole, and to our viewers as well.
Thank you, doctor. Thank you for the very informative and very thorough advice and information. Well, it's informative, but for me, it was educational. Thank you for being on the show. Thank you for accepting the gig, and I hope you do come back and discuss more things that have to do with your practice and with your specialty. Congratulations and happy anniversary to you, and hello also to your significant other, your parents, and her mother. Okay, thank you, doctor. Take care. Thanks for being on the show. Folks, we'll be back next week with another topic here on Healthline with Makati Med. Till then, take care of yourselves. See you then. Bye-bye.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views